Hi, good afternoon, everyone. My name is Isaac Marufo. I sincerely want to thank you all for being present today. Today's symposium has been a very great opportunity to have all of us join together. This breakout session is going to be dedicated to the HCEZ regional leads, where they'll have the opportunity to discuss more about their community health assessment. We did have a little bit of a technical issue earlier, so we're going to start off by presenting the video from earlier. So thank you. As we pull up the video, I do want to go ahead and give you a heads up that the first regional lead that we're going to be hearing from today is the Southwest region. So Ms. Jessica Biggs will be coming up shortly. It does seem like we're having a little bit more technical issues when it comes to that video, so if anything, Ms. Jessica Biggs, if you could please come to the stage. Yeah, so if everyone can give a round of applause to Jessica, thank you.
Does that work okay? I'm not quite as tall as Isaac. Come on up. Good afternoon. It's no longer good morning. It's good to see you all again, and I'm really happy to be here with my colleague and very good friend, Jasmine Serrano, who is also an organizer at SWAP and has been really critical to the work of both Healthy Southwest and the Southwest System of Care work that we lead together. So we're going to walk you through our process around the community health assessment development in the Southwest region today. I don't know that there's a set format. Can people ask questions as I'm moving along? Okay. Oh, nope, John has answers. Please hold your questions to the end. Okay. You can go ahead to the first slide. So we started our community health assessment process very early on, back in the summer of 2021, actually before there was an expectation from CDPH that we formally began this, because we were really committed to making sure that our assessment process really met the needs of our community leads and the communities that we serve and support on the Southwest side. So initially we convened a small data team that were representatives of community lead organizations that had an interest in this work. That team actually convened with Margarita Reyna at CDPH, who's an epidemiologist, to decide what data indicators were most important to take a look at as we were launching this community health assessment process. That team identified those indicators and used those to create what we called community profiles that were really heavily anchored in the use of the Chicago Health Atlas, and so were entirely quantitative at that point, but gave us a good starting point to understand some of the important data points that represented our communities. From those profiles, each hyperlocal collaborative or community area identified what they saw as priority indicators, things that stuck out that didn't seem to make sense or resonate with their experience, things that they saw as being really high leverage issues that if, investigated further could provide perhaps, more insight into something important in the community. And then met with, oh Lord, Jess Lynch, help me. Jess Lynch from IPHI, thank you, to think through what additional data indicators would make sense to corroborate and add a broader story to the Health Atlas. It was also at that point that several community leads decided to build out surveys or host focus groups to get a more qualitative perspective on the quantitative indicators that had been focused on. And it was through that process that priority areas were solidified. So you can go to the next slide.
Yeah, so I'm Jasmine. I'm an organizer with SWAP. I work alongside Jessica. So what was really important at the beginning, I think, to really validate is we do all of our work through the basis of relationships that we've built. And thankfully, we had relationships with folks from the city, with service providers, with federally qualified health centers, with other organizing institutions in the neighborhood. So a handful of us got together to determine how do we start the process of a healthy equity zone? What does that mean for us? And so we came together, again, with Margarita at the helm, to go through what that could really mean. What are the things we need to be thinking about? What are the data points that would actually help us understand where our community is now and maybe imagine what we could want it to be into the future? So that was, 2021. And you know, those are really impactful moments because so much of the work we had done from those meetings continued to build onto what we do today. Next slide. And so when we created this huge list, it was actually Ricardo from Esperanza who helped kind of produce this huge list of data indicators. And you know, us as organizers had to then think, what of this list is maybe what we should think about first? What should we prioritize first based on what do we have access to? What's actionable? And so this list eventually became kind of the basis of the data that we would go on to inform our community health assessments. So we used resources like the census, like the health atlas, and thankfully CDPH did a great job of kind of helping us understand what that resource could look like, right? CMAP and other resources and places that allocate data to help us really make sense of something that none of us were experts on, but knew we needed to figure out. And so, you know, with support and with resources, we were able to create a really comprehensive list of data indicators that first started quantitatively, but then they were able to inform the qualitative data later on.
So, we can't tackle all the things, right? So we held a series of meetings, first as a regional collaborative with our community lead organizations, and guided them through a process to try to identify just their top 3 indicators. And I really used guiding questions around what is most high leverage, what would be most impactful if you dug into that, what doesn't make sense or resonate with your experience and so needs further investigation. And so from those conversations, each hyperlocal collaborative determined both the data points that they wanted to dig into and the methods that they wanted to use to better understand why that quantitative data looked the way that it did. So each of the hyperlocal collaboratives used a variety of methods, and I was really clear about asking our community leads to determine their methodology that made most sense based on what they were trying to investigate. You know, as community-based organizations, we're not always experts in survey design or in the acquisition of public health data. So a lot of folks they leaned into their strengths. So one of our community leads is Increase the Peace, who their community organizing institution have really well versed in using a one-to-one relational meeting model. And so launched their methodology anchored in one-to-one relational meetings to understand some of the issues around public safety that they wanted to understand for back of the yards. PHAs provided feedback, so one of the things that we focused on the Southwest side, from beginning in COVID, we have a large team, anywhere from 40 to 80 what we call public health ambassadors, who are community members with lived experience. So public health ambassadors were able to provide experience based on their conversations in community to shed some light on why certain indicators looked the way that they did. In Chicagoland and Ashburn, that was really focused on understanding healthcare coverage. They did launch surveys to understand who had access to care currently, or who had access to coverage, who didn't, why they didn't, and what some of those barriers were. And then in the farthest southwest portion of our region, they became really focused on food access and launched a series of surveys in partnership with Northwestern to understand food access issues there. You can go to the next slide. Is that my time? 8 minutes. Okay. These are the priority areas that came up for each of the community areas on the southwest side that they spent time understanding. And if you go to the next slide, Isaac. Those that each community area have chosen to focus on and develop intervention plans around are here. So the Garfield Ridge Clearing West Lawn West Elson Collaborative is focused on food security, both access and education. Chicago Lawn Ashburn is focused on access to primary care, jobs, and food. Brighton Park Archer Heights is focused on making sure that their residents know how to make the best use of their Medicaid benefits. Gage Park Back of the Yards is focused on public safety. McKinley Park is focused on mental health, and Bridgeport and Armour Square are focusing on access to primary care. So those are the priority areas. And as a region, we've chosen to focus on public health workforce development. There were several things that rose to the surface that aligned with different community leads' priority areas. But we've chosen to focus here because we really see this as a resource that can be leveraged by any community area, any community lead throughout the southwest side to focus on the hyperlocal interventions that they have decided to implement. So if you're interested in seeing our health assessment in full, you can access it through that QR code. There was a question earlier today about accessing all of these things. We do have a healthysouthwest.org website, and our community health assessment is there as well. So that's it. And I'd like to introduce Ladarius Curtis, who's our partner from Westside United.
Thank you so much, Jessica. How you doing? My name is Ladarius Curtis. I am the Senior Director of Community Engagement and Health for Westside United. Also, a part of the great team that is involved in the West region and all the work. Our community engagement coordinator is here, Veronica Pereira, in the back. And a special shout out to not only all of our community leads, but also one of my other colleagues that actually really helped us out, Min Young Do, who was the brightest star, the shining star of this entire presentation that you're going to see right now. So next slide. So what we decided to do with our engagement and our HCEZ overview is what we came up with a mission statement. Our mission statement was to assess the working group. We'll just do a collaborative development of community assessments to understand the root causes of health inequities on the West Side. And we did that in making sure that we had our pillars, which were transparency, equity, accessibility, and inclusivity and innovation. Next slide. Oh, there you go. And it just was there. What we really wanted to do is when we got all of our community leads together, it was like, okay, we have this hairy, audacious goal to try to figure out what it is that, when you have 10 communities on the West Side that you're working with, 10 zip codes, almost, 500,000 people, it's kind of hard to sometimes navigate exactly how you want to get started. So we felt like having a mission statement and a vision was kind of our best course of action and how we wanted to move forward. Next slide. So what I want to talk to you a little bit is around the West region. So our West region, if you will. Great. So our West region, as I mentioned, is about almost 500,000 people. Our life expectancy, this life expectancy number actually is a pre-COVID number. Just so you can understand, you should subtract that number by about 4 years, ever since COVID. So we're at about a 69 years, and our median income, which obviously looks like, oh, that's nice. Actually, it's not what you think. If you took, like I like to say, this little This little small area here down, like if you had a kid who bit it and turned that little section into, called New Jersey, our median income would go down to almost 40,000. So that explains to you the exact situation that we're in along those lines and around our population as a whole with Westside United. With the group that we work with for Westside United, and here is our overall expansion of the folks that are on the West Side. Next slide. So these are our 9 community areas and 8 community lead regions that we work with. Esperanza, Austin coming together, Erie Neighborhood House, and that pretty much goes along with our map. Westside United actually does have a 10th community, Belmont Cragen, but for the HCEZ, they had their own community assessment, so they're just not listed here as a group. And now we'll get in next slide into the data and methods. Next slide. Oh, there we go. So for our data, our quantitative and qualitative measures that we used is obviously quantitatively, we, like everyone else, use the Health Atlas to really work on our indicators. Really tried to drill down after a lot of tons of weekly meetings that we worked on to really focus on everything that we thought was the best course of action with our community leads moving forward. Our quantitative analysis was a community input survey through Westside United's work and the Alliance of Health Equity. Our primary goals were to help community partners develop an understanding the health status of their own community, and then use these assets and needs to drive the health outcomes. We also wanted to lay the groundwork for an eventual action plan that we could do as a group or as each individual community. So with us, I'll share with you some work that we did for our action plan later, but that's what the addition or the idea of the groundwork really came out to be. In addition, we wanted to conduct some serious surveys, hear from our community, and also what we did is we made sure that we used the CHNAs from all the other hospitals in our area. Westside United is a part of a 6 conglomerate hospital group that we work with, but we use all of the hospitals on the West Side and all of their CHNAs to come about with this data. Next slide. So our data collection process is as follows. As you can see, the Westside United was the regional lead. Our community leads that you saw earlier, they're known as the CLs, so RLs and CLs up there. But existing data review, areas of interest and selection, a tool selection, data collection plan, survey development, the reviewing and finalizing, survey dissemination, and then survey data analysis. So the ones I would like to highlight, honestly, for me, were the areas of interest, just the basis data that just kind of really focused on 3 to 5 areas for community input. We found that we did have, out of our 9 communities, we had a lot of communities that shared some of the same issues, the same priorities, and had some of the same indicators. But what we really wanted each community to do was really focus on the top 3 as a notion. That way we could kind of work a little bit more together around what were our next steps moving forward with the action planning process. Next slide. So in our community survey overview, we did 7 surveys. We had about 974 responses, and we had about over 40 partners engaged. Our main topics are really areas that we wanted to focus on were the community health needs. We had about 23 categories in that section, and then just our overall areas of improvement. Our health issues covered the section at the bottom: housing, healthcare access, the youth, personal health, mental health, chronic disease, healthy food, and neighborhood safety. So those were pretty much what we wanted to work on and focus on. Out of our results, this is what we found. In terms of the majority or overall in our 9 communities, housing stability, mental health, and violent crime, as you can see, in our communities, 20% of them were like housing stability is top, mental health 27%, violent crime, and then COVID response. And then for our group, Our race and ethnicity, we found that 91% of our people were persons of color. What we found when we initially did this survey is that 60% of the people that were surveyed were non-Hispanic white, which does not cover the actual overall for our community, which is about 23%. They're actually white, so that's why when we really did or redid the survey, we found some numbers that really kind of fit exactly what our neighborhood and exactly what our community really stands for and really set for. Okay. And so this is how we supported the community leads throughout the process. Through our bi-weekly meetings and monthly meetings, we were able to just kind of establish some resources around capacity building and data literacy. We hosted tons of workshops and provided office hours to kind of help support anything they did. A lot of long nights and a lot of phone calls around some of these needs and opportunities. We helped our community leads just identify partners, but we found that a lot of our community leads were, working with the same 3 to 5 partners. So what we tried to do was make sure that they could expand their own horizons to meet other partners where they were, whether they were small partners with a small shop or larger hospital systems, FQHCs, or other groups that really were looking to be at the forefront of the work. Next slide. So out of all our top priority areas for each community, this is where we ended up. Austin was mental health, East Garfield Park was food access, where we're actually working on a community grocery initiative right now. In Garfield Park, South Lawndale was financial and economic stability. Humboldt Park was mental health services, where Westside United actually partnered with them to work on, with the help of Erie Neighborhood House, worked on a mental health services card that you could keep in your pocket. So if you actually feel a level of anxiety or something that you feel like is going on in your body, you could read the card and really kind of adjust and breathe, take your breathing down and get yourself in a proper measure to kind of move forward. North Lawndale wanted to work on housing. West Garfield Park, neighborhood safety, and then Westtown and near West Side were both chronic diseases. Since we'll be taking questions at the end, I will leave it there. And now I would love to introduce one of our fearless leaders for all the regional leads, Ms. Dr. Joyce Chapman.
Okay, good afternoon, everyone. I'm Dr. Tanya Roberson, and I'll be taking the place of Dr. Joyce Chapman. And I'm a community psychologist, and for the past 2 years, I have had the pleasure to work alongside with the Far South region of the Healthy Chicago Equity Zone as the public health consultant. Phelan's Family Services has always been considered the hub or the cornerstone in the Far South region. And they've been the place that the community members considered a place that they could go to if they needed help. And today we're actually going to demonstrate true collective impact by presenting our work, our data outcome, and our sustainable, culturally tailored work that we've done by including 2 of our community leads that are here with me today, and I'll introduce one of them now, Ms. Rose Zadig from Hedgewood Community.
Thank you, Dr. Roberson. Good afternoon, and thank you everyone for allowing us to speak today. The Far South region has 13 community areas and 11 community leads, including Hegewisch, which is 60% Latino, and we're very proud to be a part of this initiative. The great coalition of caring community leaders who are willing to learn so that they could be drivers within their communities and so that their work is sustainable and continuous. The Healthy Chicago Equity Zone initiative was started to address issues that were magnified by COVID-19. The Far South region pride their work in being proactive, not reactive. We want to address the root causes to close the gaps in health disparities. This was not the first pandemic, as we all know, and will not be the last. And we could not do it alone. Our teams and community leads, we work collectively and in collaboration with diverse, like-minded groups as partners to impact our community's health. We have worked with CPS, Chicago Police Department, various aldermanic offices, federally qualified health centers, and large academic medical centers, just to name a few. And because we know that spirituality is also a part of our culture, we should be highly regarded, we also have worked and partnered with faith-based organizations. When we went into the communities, our motto was clear. We want to hear from you. We want to ensure that the right people are at the table, because change is needed now. Not change by some of us, but by change from all of us. Everyone here in this room. We need more community presence, researchers working fairly hand in hand with communities, community members, leaders, and other organizations. When we went to our communities, our main research question was, what are the disparities in your communities? And what was the role of the social determinants of health that caused those disparities? So we sought who best to answer this question? The people from our communities. And now I'll turn it over to Sandra Holder to talk about what we discovered.
Thank you, Rose. I'm Sandra Holder, the co-lead of the Morgan Park Roots Organization, representing the Morgan Park community. As Rose displayed the social determinants on the previous slide, what we wanted to do was peel back the layers to better understand what are the social determinants that are causing the health disparities that we are facing in our communities. So as a result, each community lead and their organization surveyed their community by completing 300 self-administered paper surveys. Now, I think it's important to point out, what were the components of this survey? There were 4 components. First, the perception of your personal health. Second, your knowledge of healthcare in general. Third, knowledge of your family's medical history, if you knew it at all. And then fourth, personal opinions about the community in which you live. What do you like about your community? What would you change about your community if you could? And also, do you have the resources to thrive in your community? Each organization conducted 3 focus groups. Each focus group consisted of 10 members from the community, and each session lasted 90 minutes in duration. So, 11 community groups, 300 surveys, 3 focus groups each. You're probably trying to do the mental math. We already did it for you. So, in totality, we completed over 3,300 pieces of data to help us assess and identify the most prominent health disparities. Next slide. Each focus group participant signed a consent form authorizing the focus group to be recorded. Each focus group also was facilitated by a moderator and a designated note taker or scribe. All of this was to ensure the level of accuracy and integrity, but for the participants as well. who were entrusting us with this very important and personal dialogue. Next slide, please. All of the participants were excited and really felt empowered to play such a vital role in this assembled group where they candidly, very candidly, shared their thoughts, their opinions, and their experiences. I can personally recall in the Morgan Park Root sessions, and I know Hegwish as well as our other community organizations can attest, the participants were extremely passionate and really had a lot of outpouring of deep and very personal experiences and concerns, and they were not shy about sharing those with us very blatantly. And of equal importance, the community members were very appreciative and yet hopeful that their participation was going to make a true difference in the community. Next slide. So look, despite the fact that we are working in communities that are full of medical mistrust, we are still able to collect some very authentic, much-needed information to make a change. We've identified 6 top concerns across all of our communities, and we are working right now to design programs and initiatives to bring about resources, education, and solutions to address their concerns. Our top 6 focus areas are violence prevention, mental health and wellness, diabetes, cancers, heart disease and stroke, and environmental health. Not necessarily in this order, however, the prioritization is based upon the unique needs of each of the communities. As for the Far South region, we stand firm and committed and will continue to do our due diligence to ensure that our communities are being supported, services are being rendered, and solutions are being delivered. Next slide. Why, you might ask, why can we stand so firm in our commitment? Because in the Far South region, we are cohesive and we are prideful. Many of you in the room may be familiar with the African proverb, if you want to go fast, go alone. But if you want to go far, you go together. We are very proud of the community advancements that we have collectively, keyword collectively, achieved. We have been able to positively impact many lives in our designated communities. And our team right now is ready, more than ever, and capable, quite frankly, to continue all of the fine work that we have already embarked upon. And we are confident that we know we can accomplish this together. Next slide, please. This concludes our presentation for the Far South region, and with that, we humbly thank you for your attention and for your time. And at this point, we would like to have you please welcome the Northwest region to the stage.
How's everybody doing today? Everybody still up? How are we doing? Thank you for that introduction. My name is Brian. Brian Morrow. I'm here through the Northwest Center. We're based off of Belmont Cragen. I'm also I'm repping and I'm a proud member, resident of the Northwest region of Chicago. So let me just hear it for the Northwest side. Let's not forget about the Northwest side. Next slide, please. Next slide, please. And so with that in mind, these are some of the neighborhoods that the Northwest side is comprised of. And just before I start, I just want to give a quick shout out to the other community leads that are also in the room. NRC Commission, North River Commission, of course, myself, Northwest Center, MFS, Metropolitan Family Services, and Palenque LSNA. Next slide, please. So as y'all have heard, through soft polling, through surveying, through focus groups, actually going down to the streets, actually talking to folks, we've been able to derive our top 3 priority areas by talking to the people. So next slide, please. And these are our 3 priority areas: housing, public safety, and health and human services. Next slide, por favor. So with these issues in mind, we, Northwest Center, already had 2 huge imminent health problems in play. Unfortunately, Beaumont-Cragen has had a 160% increase in pediatric diabetes, and that's just for one neighborhood. 162. I want to let that sink in. 162% this year. It's been 160% increase in pediatric diabetes, and another issue in mind here is 60% of children in Chicago overall are affected by asthma. And we quickly, as the Northwest region, identified these as public safety concerns. You know, we usually think of public safety as gun violence, gang violence, you know, things of that sort. We sometimes forget to regard and really make some space and to talk about other factors that are also considered public safety, such as having asthma, having diabetes, you know, something that affects your personal health, you know, your condition of living. You can even say that these issues right here are environmental and food insecurity issues, since kids don't seem to have the accessibility to healthier food options, whether it's the knowledge gap of how to live a healthy lifestyle, or how to to know what to eat, or whether it's just simply due to accessibility. Regardless, there's something missing. And also, just in addition, we're also very much used to thinking about housing in a sense of affordability, which is also a huge concern, a huge problem here. We do need access to affordable housing. However, once you have a house, once you live there, is it good living conditions? Can you live there? You know, is it livable? You know, and with one of our partners, actually, Larry's, we've derived some data that, you know, where actually asthma has unproportionately affected children in Beaumont-Cragen and Austin community, also kind of a little south of the Northwest region, but we're still neighboring communities. So we've been affected unproportionately by asthma. And so right away, also there's very limited data in this, which is something that we touched upon prior in the earlier session. We do have access to the Chicago Atlas. Yes, it's a beautiful source, but we still want more, and we need more funding for more data because, again, data is so limited. And I just found this out this year about how heavily and how unproportionately we're being affected in these Black and brown neighborhoods, even up north. Next slide. Next slide, please. Yeah, and with that in mind, it led us to start these initiatives, but these were all community-led initiatives by community health workers, actually. Our community health workers became the spearheads of our local initiatives to try and combat these issues, as I said. They worked with Lurie's Children's Hospital and their All Hands Network program, and they're becoming trained inspectors now. People, regular beings, just regular folks from the neighborhood, they're becoming trained inspectors. You know, people that actually work 9 to 5s. I have community health workers that worked at Target, worked at Walmart, worked at Chipotle. Now they're out here doing something for the community that they grew up in, the community that they cared about. And it's nice to see them develop in that way as well. But so as we identified, going back to our work with Larry's, they've become house inspectors now, and we've chosen 20 families in Beaumont-Cragen whose children are unproportionately hospitalized because of asthma, and the goal is to assist in identifying the root of the health problem in their homes with our lead and mold prevention programs, known as the Healthy Homes Program, as stated above here. And we've also taken another initiative with our partners at Erie and Chicago Cares. I don't know if y'all are here, but shout out. And we've partnered with them and local restaurants to help modify or even create a whole new dish that's diabetes friendly, with the goal to reach at least 12. And this is a pilot program. So far we have 11, one's in the process, and these plates are coming out, and it's great to see that now this neighborhood has local restaurants owned by residents have good diabetes-friendly dishes now. It's amazing to see it now. We're starting to see it flourish around the neighborhood. And so we currently have one in process, but we have 11, and we're hoping to keep this going. There's plenty of restaurants to go in the city, and not all of them are diabetes-friendly, so we got work to do, y'all. Next slide, please. And just to mention some of our partners' work that they've been kind of honing in on public safety. They've partnered with, they targeted public safety by finding outlets, for Irving Park youth to really express themselves and have some kind of outlet to keep themselves occupied and away from the streets, away from anything else that could be of burden. And through programs like Mexican music program and the gang resistance education training, we found different outlets for youth to, and we're still finding different outlets for youth to just take advantage of and just enjoy. And I got to give a shout out to the founder of this by Rala Klepak is the foundation who is actually helping us make up these or come up with these outlets. And with that in mind, I'll pass it over to my colleague Conan.
Okay, perfect. Hi everyone, my name is Kanan Raja. I am a public health and safety specialist at North River Commission. So I'm just going to be talking about the work that we are currently doing as a community lead in Albany Park. So many of you have seen Dahlia speak. She was on the panel earlier, and she also is our director for public health and safety here at North River Commission. One point that I do want to hammer home that she brought up many times is that the data that we're currently seeing regarding the Northwest side, and specifically our community in Albany Park, doesn't really reflect when we go out into the community, what these members are saying. And so public safety was actually the #1 primary concern amongst our community specifically. Through focus groups, through gathered community intelligence, through surveys, polling, etc., we were able to gather all this community intelligence and specifically focus on 3 areas that our community felt were extremely important. The first being on wanting to expand violence prevention programming and survivor resources. The second being advocating for alternative ways to deal with conflict and violence that don't involve the police. And the third being to identify and address street deficiencies that make Albany Park unsafe, because when you feel unsafe, you are unsafe. And if you see this graph right below, it shows the problems as well as the solutions. This is just a small little chart that we conducted that illustrate when we went out into the community and asked them, what exactly are you identifying as problems of public safety within your own community? This is what we were able to gather. And then when we also asked them, how would you come up with a solution? This is also what they said as well. So I'll go more into depth on this on the programming that we're doing. Perfect. So specifically with these 3 areas that we had in mind regarding expanding violence prevention programming and advocating for alternative ways of dealing with conflict and violence, and then finally addressing these street deficiencies, we came up with specific public safety projects. The first being healing villages and restorative justice circles. So this was an idea that actually our youth had in several high schools, and we just continued to carry that work out. For those that do not know, healing villages are intentionally carved out spaces to connect and help prevent the circle of violence with the lens of restorative justice in mind. So what this looks like a lot is in high school programs specifically, we'll have community members, local social service organizations, teachers, parents, etc., come to a designated space where they have activities that they can engage in regarding mental health. And these are programs that are created and led by the youth. A lot of these youth are from different diverse and ethnic backgrounds where mental health is not really a space that they feel they can particularly speak about at length at. So this is an intentional space for them to bring their parents out and their other community members and actually talk about mental health in a safe zone. The second being mental health first aid. This is our method of advocating for alternative ways to deal with conflict and violence, specifically in increasing access with our social service organizations so that the people that have boots on the ground, that are constantly in the face of the public, now know how to deal with mental health as a bystander when they do see a crisis occur. And the third, for specifically addressing street deficiencies that make our streets unsafe, we've come up with a youth-led mentorship program that partners local students with college GIS mapping students in order to not only identify through social media where they see street deficiencies, but then use this public health program in order to then see, do these map out with areas that are actually unsafe in Albany Park? My guess is probably yes. So this is the ways that North River Commission is specifically working within our community to address public safety. And I'll give it back to Brian. Thank you.
And just kind of to wrap things up, shine some light on one of our other community leads, I'd like to talk about some of the initiatives Palenque LSN has partaken in. One of them, and most importantly, probably, and I'm sure you guys have probably heard of this initiative now, it's citywide, is treatment, not trauma. And we can go on this for hours, but I'll try to wrap it up. And really, it's an initiative to change the typical response we have when the cops are called. As we may know, like the neighborhoods don't feel, there's a lot of mistrust in the community. Besides medical distrust, there's a lot of police distrust in the police. Understandably, we have our history. And for that reason, we'd like to change the response to that. And what treatment not trauma really revolves around is when you call 911, instead of having a cop come, you have a social worker come to deal with whatever the issue may be. And because things may escalate when there's a cop, maybe not. And just to kind of emphasize the lack of mental health facilities that there are in the city. In Belmont-Cragen, we only have 1 or 2 facilities that are open from 12 to 3, 4 days a week. So if you have a mental crisis, it better fall within 3 to 4, so between 12 to 3 for those 4 days of the week. So, it's very limited. And besides this, Palenque has taken initiatives with their youth and are constantly advocating for more affordable housing units and establishing a community land trust for the people to be able to acquire home ownership and really take ownership of the neighborhood themselves rather than having to fall into the hands of gentrification and leaving it up to other people to fix your neighborhood when it's really our neighborhood to begin with. And with those last thoughts in mind, I just really want to emphasize that this is all community-based work, and this work couldn't have been done with without community health workers, and they're galvanizing their neighborhoods, and they're empowering other residents, and if they're prompted to, they will take ownership of their health. And I think that's our role. That's where we come in. That's where we empower them. And I just think that those are my last 2 thoughts, and I'd like to pass it on to the near south. Thank you very much.
All right, now I get to say good afternoon, because we've been here all day. Good afternoon. How are you guys? Yay, you're still awake. So I promise I'm going to be quick because I am standing between you and happy hour. At first we were standing between you and lunch, and now it's happy hour. So I am here on behalf of Greater Auburn Gresham Development Corporation, the Near South region. It is a pleasure to talk to you guys about our community health assessment and what we have done. So I actually have the community health assessment just to show you guys, and then I'll give you the information that we got. So basically, what we do in the Near South region is not just about GAGDC. It is a community of partners, and we are only able to do that through our various community leads. So I would definitely like to, South Shore just walked out, but I was gonna shout her out. Bryce Starr is still here. South Shore Works, Chicago Family Health Center, the Kindness Campaign, Teamwork Inglewood, Centers for New Horizons, and Project Hood. This is our regional structure for the Near-South region of GAGDC. So when we say it's not just us, these are our boots on the ground, and this is how we're able to do the great work we do. As I told you guys a little bit about the community leads, here are their logos and their mission statements. So please take a picture if you would like to learn more about them and what they do in the Near-South region so that you guys can make sure that you're in tune with them. So basically, our data collection was phases and processes. First, we formed coalitions across the Near-South region. Then we came with our surveys, and we did our surveys a little bit different. We did a Near-South regional survey. A lot of the regions did individual surveys within their community leads, but we decided to create one for the entire Near-South region. And so we all disseminated the same survey to make sure that we had consistent results, to make sure that we were able to quantify our data. In addition to that, we did the focus groups, and we also did personal interviews with people to talk to them about the health disparities in their community, to talk to them about access to equitable health care, to talk to them about what they need. There goes South Shore Works, hey. And so yeah, in a part of one of these focus groups, we were able to have Mayor Lori Lightfoot. She participated in a violence prevention focus group, and we were able to just talk to her, not only from a government standpoint about violence, but she was able to hear from the people on 79th Street, the people in Bronzeville, the people in South Shore, to hear about their concerns with violence. So our Near-South regional data overview, we collected over 1,700 surveys, 20 plus focus groups, 100 plus interviews. The height of our survey results, we take pride in this, came from the 25 to 34-year-olds. These are the voices that we feel like we don't hear from, that we don't know about. These are the voices we feel like are not as engaged as they should be. And they're the ones that we had the highest participation from. The second highest is also something we take pride in, which is our senior community a little bit, ages 55 to 74. So we heard from the elders in the community, and we heard from the youth in the community, and we were able to base our assessment on those. So our survey results by zip code, it shows you a breakdown of where the most of our surveys came from, and of course it was Bright Star. So majority of our survey results from the community zip codes of Bronzeville, which is Bright Star, South Shore, which is South Shore Works, Greater Grand Crossing, which represents the Kindness Campaign, our community lead, Kenwood, Douglas, Chatham, and Auburn Gresham. So we literally had boots on the ground in all of these communities, and these are the people that we got our survey results from. These are the residents that we got our survey results from. Again, so the survey results showed us that they do think health issues are a concern. They do think that community improvements are a concern. They do talk about the needs to create a healthy community. So we just wanted to show you guys the actual results of where it came from. But because we're short on time, I won't go too deep. Next. So our survey findings, basically with more than 1,700 surveys completed, we learned that 90% of the residents, well, let me back up. Over 1,700 surveys were completed. 90% of the residents were African American, with over 40% being between 25 and 34. The survey responses with the largest percentage were for violence issues, safety issues, and our residents want a safe community with low crime. They identified that mental health is also a problem, and the third thing that they identified was that diabetes was a health disparity in our community. Next. The Near-South region health inequities, due to the work of our community leads through the coalitions, focus groups, and surveys discussed, there are three primary areas that I've given you a preview to, which is public safety, mental health, and diabetes. These were the most prevalent health inequities discussed and addressed among the participating people. And these are the things that we're focusing on in the Near-South region right now. So I want to give you a quick definition, because everybody's like, well, what's public safety? So it refers to the welfare and protection of the general public, right? And public safety has so many different aspects to it. Is it domestic violence? Is it violence prevention? Is it gun violence? And so being able to identify what public safety for the Near-South region was very important. And then, of course, we know the importance of mental health and diabetes. Next. There is a need for public safety. That's what we learned in our Near South region. It's not just a need that we see of the people creating and making programs, it's a need of the community. Not only did they believe that violence prevention was a need, but they also wanted to focus on mental health and quality education. Next. We know why public safety is a need, and the biggest thing I want you guys to know is that everybody wants safe communities, and we can have safe communities. We just have to figure out how we can create them. We have to figure out what are the needs of the people that are doing the most violent crimes, and how do we make sure that we address them and also their mental health. Next. So our next steps are going to be, one, we want to build better relations with the police. We have decided to do a police accountability forum quarterly because yes, the beat meetings are okay, but they could be better. So being able to talk about the goods and the bads in each police district, as well as how they can work with the community in collaboration. We also wanted to do some community accountability. If you see something, say something. We know how it is, but at the end of the day, if you don't tell them that we're not accepting this on this corner, they will keep standing on that corner, which then possibly something else bad can happen. So we need community accountability. Take pride in your community and let them know that you want better. You want a healthy community, and we will not settle for nothing less than that. And then third, and certainly but not least, is action and commitment. Now that we have identified that public safety is the goal, how can we work with our local organizations, our mayor's office, our local aldermen? How can we make sure that we are putting things into place that we talk about? We don't just want to talk about the issues, we want to implement some solutions for them. And so that's what we're focusing on in our next steps. Next. Is that it? That's the last slide right there. So basically we have been able to accomplish this great work through our partners and coalition members. Special thanks to our community residents who participated in the surveys, focus groups, coalitions, and interviews. Special thanks to our community leads who led this work. And special thanks to CDPH for allowing us to be here. It is our pleasure to be able to do this work, and we will definitely keep it going. And on that note, I just want to say that I'm happy I didn't have to go behind this man because he is amazing. And Patrick is going to close the show as I pass it over to the North Central region.
Thank you for that great introduction. So I only have 3 minutes, so I'll be quick. I'm not going to bore you. So my name is Patrick. 6? Okay, perfect. So my name is Patrick Bill Daniels. I am the Assistant Director for Swedish Hospital, who has the privilege of serving as the North Central Region lead. What's interesting about the North Central Region, that's our map right there. So we go as far north as Rogers Park, and we come as far south as to the South Loop. So people wondering, how do we get that far? So what's interesting about our work and what we do is we have very diverse communities. And when people talk about the north side of Chicago, especially where we talk about it from a place of privilege. So we had the privilege, myself, Moyo, and Najla and I, who's part of this amazing team, to just dig deeper into these communities to see what the disparity challenges were. And we were able to assemble a great team of community leads, and we have many of them here today. So I'll just speak briefly about them. Over in Uptown, we have Apnagar. Apnagar, they focus on safe homes and yes, Apnagar, yes. So, Kavita and her team, they've done an amazing job over in the Uptown area. They're focused on safe homes, emergency housing, case management services, providing counseling for individuals as well as trainings. One of their big things is addressing violence in the homes that young people experience as well as parents. Apnagar provides critical, comprehensive, culturally competent services, conducts outreach and advocacy across communities to end gender violence. Over in West Ridge, we have the privilege of working with ICNA Relief. Zach, my man right here, spearheads a lot of that. The first time I was over in West Ridge, I was amazed at not only the great work, but the clientele and how many people were in need of services. Coming from the west side of Chicago, born and raised, Many of the food pantries that I attended was only for people who looked like me. But when I went over to West Ridge, I saw that that was not the case. And disparity, when we're talking about food insecurities, it expands beyond certain communities. There's no discrimination when it comes to that. Ignorant Relief, they also focus on case management services, health and wellness services. This organization specializes in addressing a multitude of different community issues which may impact the underserved immigrants and refugee populations in West Ridge. Some services include providing case management, food distribution, and education to adults around various health issues and ESL classes. Many of the individuals over at West Ridge have not gotten routine checkups, so that's where the partnership with Ignorant Relief and Swedish Hospital has come into existence and has served many, many people. Also in West Ridge, we have the privilege of working with RCC. RCC is the Rohingya Culture Center, and Sarah here, who is also an avid runner, we've been in community sometimes, and she just run past me, and I'm like, oh, that's Sarah. Sarah is doing an amazing job over there in West Ridge with the Rohingya Culture Center. The Rohingya Culture Center, they're focusing on youth programming, senior programming, and case management. This organization specializes in addressing a multitude of community health and social concerns which may impact the underserved population within West Ridge neighborhoods. Some of these services, programs provided to community include youth programming, religious studies, academic support, sports events, senior programming, women health support groups, case management, general health, wellness, education, and outreach. Sarah has done an amazing job of educating me on the Rohingya culture. Many of these young people, when they come to America, they have not attended school. Some are 16, 17, and things of that nature. Another round of applause to the Rohingya Culture Center because they're having a graduation today. So we're having young people graduate from high school. Many of them have full scholarships to college. So great job, Sarah, and to your team for that amazing work. Over in Lincoln Square in Edgewater, we have the privilege of working with Lutheran Social Services of Illinois. They focus on behavioral health service, addiction studies, community education. Lutheran Social Services of Illinois and Edgewater and Lincoln Square specialize in mental health and substance abuse services. This includes alcohol, drug treatment, mental and behavioral health services. Over in Lakeview, we're working with Thresholds, another organization who's doing some amazing work to address substance abuse, integrating primary and behavioral health services, as well as housing. Thresholds provide services and resources for persons with serious mental illness and substance abuse use disorder in Illinois. Programs include substance abuse treatment, crisis response, youth services, justice program, peer services, housing the homeless, and art therapy. Another organization we're working with in Uptown, C4, Community Counseling Centers of Chicago, Crisis and Medical Services, Trauma Recovery Health, Counseling Services, Youth, and Family Services. Swedish, we had the privilege of serving as the community lead over in Lincoln Park. Now we're working with Miralax St. Vincent's. They're incorporating some of Swedish's pathway services, Food Connects program, as well as community health classes. When we get down to the South Loop and the Loop area, which was an eye-opening experience for us when we realized the teen pregnancy in the area, the dropout rate in the area, as well as in the homeless area, in those areas. We have the privilege in those two communities to work with a faith-based institution, Willow Creek, as well as the All Stars. So, to say all of that, as I conclude, we hosted community needs assessments, we hosted focus groups. Shouts out to Mary and Molly from Over Tapestry Health, who spearheaded a lot of this and gathered a significant amount of this data. For additional information, go to the Swedish table right here and check that QR code. Thank you.
Thank you so much to all the regional and community leads for being able to present today. And thank you for all of you for joining us at the HCEZ breakout session. I do want to invite John Jones onto the stage as we conclude this session and transition to the next one.
No need to clap, no need to clap. Thank you to all 6 regional leagues for participating in that breakout room. I hope we all learned something new. So now we did mention that there will be a Q&A, however, with time, we are unfortunately unable to do that. However, what I will recommend, we still have our partners here tabled. So if you have direct questions that you realize during that whole session, I do strongly recommend that you go over there during our little break session we have now, or before the end of the symposium today. So now we will be transitioning into a quick break, and at 2:15 we will be closing out. We will have some of our team from the evaluation side from UIC present. We will also be hearing a spoken word from a West Side legend, and then we'll be closing out with some final action steps and then departing our ways. So please return back in the room at 2:15. Restrooms are back into the back right corner, and we do have water and food available still. Thank you.